My name is Maria Wynn, and this is my healthcare management issue presentation addressing the gap in mental health services for developmentally delayed deaf adults. Mental health is a critical component of overall well-being. However, there is a significant gap in the provision of specialized mental health services for individuals who are both developmentally delayed and deaf. This presentation will explore the challenges due to the lack of these services. We will explore the unique communication barriers faced by this population and the profound impact on their mental health. A significant healthcare issue is the lack of mental health services designed for developmentally delayed deaf adults. This inadequacy significantly impacts the delivery of care and requires alternative approaches. To fully support this population, it is crucial to have comprehensive and tailored mental health services that specifically address their unique mental health challenges. The iron triangle model is a fundamental concept in healthcare that describes the delicate balance between three core components: cost, quality, and access. Cost refers to the financial resources allocated to healthcare services, including expenditures on facilities, personnel, and technology. Quality incorporates the standard of care provided, about factors such as patient outcomes, safety, and adherence to clinical guidelines. And access relates to the availability and ease with which these individuals can obtain healthcare services, including factors like geographical location, insurance coverage, and communication. Quality, cost, quality, and access. These three elements are interdependent, and improvements in one area can often come at the expense of another. Cost management in healthcare is crucial because it helps hospitals and clinics use their money wisely. It ensures that resources like doctors, equipment, and medicine are used efficiently to meet patients' needs and provide good healthcare. By controlling costs, healthcare can stay affordable and accessible. However, it is important not to cut costs in a way that could harm patient safety or the quality of care. Effective cost management also allows hospitals to invest in new technologies and treatments. Policymakers and regulators consider healthcare costs when making rules, which affects how healthcare is delivered and for. paid for. Overall, managing costs helps hospitals run better and improves patient care. Quality healthcare is essential for ensuring the best possible outcomes for patients. To achieve this, it is important to follow established clinical guidelines and best practices. Regular assessments and audits are necessary to monitor service delivery, identify areas for improvement, and ensure compliance with regulatory requirements. It is also crucial to provide ongoing training and development for healthcare professionals to equip them with the necessary knowledge and skills to provide high quality care and stay up to date on evolving practices. Expanding access to healthcare is a complex process. Utilizing telehealth programs can improve accessibility by providing remote consultations and services. Collaborating with other healthcare facilities helps build a network of care, offering patients access to a wider range of care providers and treatment options. It also It is also important to prioritize language and communication for the deaf community, ensuring that patients can fully understand the information provided and actively participate in their own treatment. Limited availability of mental health services poses a significant challenge in healthcare management. Institutional barriers such as insufficient funds, restrictive regulations, and a shortage of qualified mental health professionals intensifies this issue. These constraints hinder the ability to provide comprehensive care and support to individuals with mental needs. To address these challenges, healthcare organizations can implement strategies such as staff development to enhance the mental health competencies of existing personnel, advocate for policy changes to increase funding and support for mental health services, and establish partnerships with external mental health organizations to expand service offerings. By overcoming these obstacles and implementing effective strategies, healthcare organizations can improve access to mental health services and enhance patient outcomes. Effective healthcare delivery hinges on strong internal and external partnerships. Internal unity among the departments is fundamental for efficient service delivery and improved patient outcomes. When departments collaborate effectively, they can optimize resource utilization, reduce redundancies, and enhance overall care coordination. Beyond the organization, establishing external partnerships with other healthcare facilities, government agencies, and nonprofit organizations can expand service offerings, share knowledge, and improve access to care. Additionally, engaging with community and professional networks keeps healthcare organizations informed about emerging trends, best practices, and patient needs. These relationships are vital for staying updated, advocating for patients, and ensuring the delivery of comprehensive care. The outbreak of COVID-19 led to a significant increase in the use of telehealth services, which provides the positive impact on the availability of medical services. The telehealth programs have been successfully implemented in healthcare organizations during this period to prepare them for further development of such services. In addition to telehealth, there is an understanding of the requirement for increased availability of mental health services to fit the needs of specific populations, in this case, the deaf community, creating new community programs that address the problems of social integration can enhance the quality of life for those with developmental delays and deafness. These strategic initiatives are in line with the vision of the organization in the provision of total care support. The lack of specialized mental health care for developmentally delayed deaf adults is a difficult issue that can only be solved with an appropriate balance between cost, quality, and access. Using the triangle model as a framework for discussion helps to show how all of these aspects are interconnected. In view of this, it is important to focus on the issues of cost, quality, and access to facilitate the best results. By focusing our attention on the developmentally delayed deaf adults, we establish a healthcare system that can address the needs of the disabled. The biggest thing to remain consistent in is to ensure the right environment is offered to support these individuals. Concludes my presentation. Thank you for your time and attention. My name is Maria Wynn from Franklin University.